Good afternoon, everyone, and welcome. Thank you so much for joining us today for Meet the Advocates. The budget is a values document. My name is Nora, and I am the Development and Events Manager here at the Western Center on Law and Poverty. Today's conversation is a collaboration between two organizations that have been analyzing California's budget and its real impact on people's lives, the Western Center on Law and Poverty and the California Budget and Policy Center. We are so grateful to have so many of you joining us from across the state. Before we get started, just a few housekeeping things. Today's webinar is being recorded, and a link to the recording will be shared with all of the registrants following the event. To keep the audio clear for everyone, all of the attendees are muted by default. As I mentioned before, please use the Q&A feature at the bottom of your screen to submit any questions you may have throughout the session, and we'll do our best to get to as many as possible towards the end of our conversation. We will also be dropping resources and links in the chat for more information throughout the webinar. So today we're here to talk about something that affects millions of Californians right now, the governor's proposed 2026 through 2027 state budget, and what it means when combined with federal cuts under H.R. 1. If implemented, the budget could cost 1.4 million Californians their health care coverage and would cause 3 million households to lose CalFresh without protection. Housing and homelessness funding faces a 56% cut, just as we are finally seeing progress. This is a critical moment that requires us to fight for a budget that reflects our values and protects safety nets for all Californians. And understanding the budget and what is at stake is the first step. And to help us do that, I'm pleased to introduce our two speakers today. Cori Racela, who has been Western Center's Executive Director since January of 2025. Prior to that, she was the Deputy Director and a Senior Attorney at Western Center for 6.5 years. Her background is in health policy for low-income Californians, with a focus on Medi-Cal eligibility and due process rights. We also have Chris Hoene, who has been the Executive Director of the California Budget and Policy Center since 2012. He has 20 years of leadership in state and local policy research and analysis, particularly on fiscal policy issues, and has worked with the National League of Cities and Center for Budget and Policy Priorities in DC. Chris holds a PhD in political science from Claremont Graduate University and a bachelor's degree in political science from the College of Idaho. And with that, I will turn things over to Cori and Chris. Welcome, and thank you both for being here.
So, as we both talked about, these are really difficult times, and I think about it in really two ways. We have the state budget, which we're really going to focus on today, but that doesn't exist in a vacuum, and we are operating under the specter of massive federal budget cuts to many of the programs that shape the lives of people in California, particularly those who rely on government programs. So on the one hand, we have a state budget, and on the other hand, we have what we like to call H.R. 1 because we try not to say the big, beautiful bill act. But, can you just get us started talking about the state budget that the governor proposed in January and what you think the major issues are? And we'll eventually get to what opportunities we have to mitigate the harms in that proposed budget.
Yeah, absolutely. I mean, I think it's impossible to start a conversation about the state budget without talking about the hangover that's hanging over state officials' heads as they start to craft a budget this year, including the governor with his proposal in January. They know that H.R. 1 was passed last year. The cuts of that are a known quantity. We have a pretty good idea about what the estimates of who will be impacted are, how many people, the cuts in the state budget. We know that those cuts, and we can talk more about the details of those here in a bit, but we know that those cuts are phased in over a 5-year or so period. And so state leaders have known there was going to be some kind of a hit coming in 2026. Some of that even started in 2025. So they had to deal with that reality coming in. And I think what we were hoping, I think what a lot of advocates were hoping was that we would see the governor come out boldly the way he has done in many other instances to represent the resistance against these federal attacks on our state and on our residents, and And instead, what we saw was a state budget that basically came out and essentially takes a wait and see approach and mostly ignores the coming cuts and the fact that people will be losing health care, food assistance, the state budget will be losing money, the budget will potentially be losing more money in the not so distant future. And there aren't really any solutions offered or plans for how the state might want to like work to keep people enrolled in the programs. So it was early, it's January, they're still working through a budget process now, but I think we were disappointed to see no concerted effort mapped out by the governor. Now, in fairness, the legislature, I think, is going to take a somewhat different position and is probably working through some of their own views of that right now. But I think in terms of the governor's proposal, it was pretty unremarkable and therefore kind of disappointing that we didn't see more.
Yeah, and I mean, from our point of view, we agree on all of those points. And in many ways, we were, I think, horrified is a fair word to say, the ways in which the governor's budget amplifies some of the harms of HR 1, particularly with respect to immigrant communities,
Mhm.
taking a work requirement in SNAP or in Medicaid that didn't have to apply to state-funded programs like our expansion of food and health benefits to certain immigrant populations, but
Yeah,
just rolled that forward. So I found
yeah,
especially galling after his State of the State address, in which he talked about, who we are as Californians. But
yeah.
anyways, I just had to interject that too.
Yeah, well, and I think one of the other parts of this that's disappointing is, I think the sort of you would think the response would be some kind of resistance at the state level, some kind of okay, we're going to try to undo some of the harm, even if they can't do it on a dollar for dollar basis or on a program for program basis. Um, and actually, instead, what we saw in the budget that it was enacted back in June, so for this fiscal year, is actually some of the same kinds of harm that are in HR 1 started to actually be taken independently at the state level. So state leaders started to become concerned that the state level costs for Medi-Cal, for instance, were too high and decided to walk back on the commitment they had made to making sure everyone in California, including those without status, could access Medi-Cal or Medicaid. So that was almost like exacerbating the challenges of HR 1. And now we have some of the same thing. The governor in this year's budget proposal, instead of protecting the state part of Medi-Cal, the part that the state funds alone, and doesn't rely on federal dollars, he actually takes the same work requirements, or he would take the same work requirements that are so harmful in the federal HR 1 package and says, oh, we're going to extend those to the state level part. And I think he's sort of saying, well, it'll just be administratively easier because everything in the program will be the same. Well, that's a pretty lame cop out to like essentially put new paperwork requirements that are going to kick people off the state system at the same time that the federal government is doing that. And then there are further restrictions on immigrant populations that he's proposing. So instead of actually seeing the like, no, we're going to try to undo the harm, we're actually seeing the like state potentially do even more harm than the federal government has done. And now, granted, that's all still in play this year, but I think it's an example of how unfortunate the budget proposal was in January.
I have so many thoughts about this, but one of the things that you said about the governor's excuse about paperwork, administrative burden. It's not as though we haven't operated a highly technical, super complicated program
Yeah.
for 15 million people for a very long time now. And I think what is also disappointing is how it plays into these tropes of who does receive benefits, whether or not they work. And we all know that this is an administrative burden and that people will be sort of kicked off their benefits because they just can't keep up with the paperwork. But it is certainly a convenient way to talk about limiting enrollment by placing the conceptual burden on the recipient of those benefits.
Yeah. Yeah, absolutely.
Do you have a sense, or can you share about how many people you think are going to be impacted by these specific cuts?
Yeah, I mean, some of these numbers have a little bit of a moving target to them, but I think that the mainstream estimates are that the cuts to Medi-Cal or Medicaid will potentially result in 2 million people, primarily immigrant populations, and their families that will no longer be eligible or will lose their eligibility for Medi-Cal. And on the CalFresh side, the food assistance program, or SNAP at the federal level, as it's called, there are about 3 million Californians who are primed to have their monthly food assistance benefit reduced, for some of those households, probably eliminated altogether. So we're going to see, suddenly several million people without health care that had it previously or had access previously, and a couple million people who suddenly are facing some food hardship that they weren't previously experiencing also.
Yeah. Um, I feel like as a health advocate from the beginning, I want to talk about Medi-Cal all the time. But before I get us too far down that rabbit hole, are there any other state budget impacts that you think we should really highlight or talk about?
Yeah, I mean, I think one of the things important to understand is to kind of delineate. There's overlap, but there are like the people impact sides, right? So those numbers I just shared with you are like people who are not going to be able to access benefits that the state has been administering, counties have been administering on behalf of the federal government. And those dollars essentially pass through to the individuals. Those aren't really dollars lost to the state budget. And then there are places where the state itself is actually going to have either additional costs or lost revenues. So 3 million people could face some impact to their food assistance, but the state also has to pick up a percentage of the costs of CalFresh for the first time. This has historically been a program that was 100% funded, or essentially 100% funded by the federal government. And for the first time in history, HR 1 says the states actually have to take on a cost share of that amount. So the state is just starting to build that into the budget now. At the low level, it'll be an addition of somewhere in the neighborhood of a little over $2 billion in cost to the state. When it gets to full implementation, it'll be around $5 billion. So, those are big numbers. I mean, if you're in the safety net arena, where like sometimes we're really excited about wins that are in the $100 million range in a given budget, to suddenly have $2 billion to $5 billion drop out of the system is not a minor thing at all. And so those are so the state has to plan for its own budget impacts and then also decide what it wants to do about the people impacts from a policy perspective. And those are going to then have costs too.
Yeah, for me, thinking about some of these costs is that it might be saving for in the context of the state budget, but the costs really do come up in other places, right? If people will still need food, people will still need healthcare, and all of that gets sort of displaced from the budget. Um, yeah, so it's really hard to think about the fiction of this is all contained, what people are experiencing in their lives in their homes, because they might lose a couple, we might lose this massive budget uh, fight, but the costs show up in the system in other places, in food banks and emergency rooms and things like that. Um,
Yeah, and I think the other part of this is there's really a local impact. The folks that are your followers, members, readers, et cetera, are working in sectors, state and local, and the work that they do. And the counties are going to see some of the same hit, right? The County State Association of Counties estimates that they're going to see about a loss of somewhere in the neighborhood of $9 billion in federal dollars that were flowing to counties to administer these programs. So the counties don't really have a lot of revenue sources available to them. They can't raise their own property taxes. Their sales taxes are in many instances kind of maxed out. So when these dollars go away, they don't have a place to go to other than to look to the state and say, can you help? Um, Otherwise, they have to make cuts on their own. And I think we have a lot of counties around the state right now that are actually trying to think creatively about how they keep people enrolled in these systems. So even though these things like work requirements are going to make it harder for people to stay enrolled, the cheapest way to keep the people enrolled and have the dollars flowing is to make sure they're signed up, the federal dollars keep flowing, and then the cuts don't come to the state and the federal. But that's going to take extra work. It's going to take extra person power. It's going to take
Yeah.
extra like online and outreach efforts. So that costs money too, right?
But we know how to do that, right? We did this in the
Mhm.
pandemic, people on benefits, and we minimized
Yeah,
a lot of the paperwork that people had to do. Obviously, the federal government was in a very different position at that time, and they were pumping money into states to make sure that people could get their benefits. But we do know how to quickly keep people on benefits, to allow other systems to have automatic redetermination of eligibility, to allow self-attestation. I just want to acknowledge that we're talking now about how do we spread, um, very limited dollars across the state. And we'll get into what it looks like to have revenue solutions in a little
yeah.
bit. But any other state budget highlights you want to flag for us?
I think when you, aside from, those key safety net programs that take the brunt of the cuts at the federal level, and then the lack of a state response, I think the other major area of concern, at least in the governor's proposal, we'll see what the legislature puts in place, is that after 5 or 6 years of the state making some significant, admittedly one-time, not ongoing, investments in combating homelessness and building up support for affordable housing, those one-time dollars are all being allowed to sunset or expire, and the one program that's left, the HAP program, which has been providing local government grants to cities and counties, is actually now down to basically half of what it had in its last round of funding. So it's essentially been allowed to be cut in half with no additional support. And I think, as you said at the outset, or as Nora said at the outset, like to do that right at the time when we actually are starting to see the reductions in the counts for the first time, and there has to be a connection to the funding and the sustained funding and the reductions in the counts, and then to pull the rug out from under cities and counties and say now the state's not in this business anymore, is really a surprise. Newsom's taken a lot of heat over the years for this issue, and he's tried to say, please wait, we're trying to make the investments, we're trying to build out new strategies for this. And then to, like, in his last budget say, yeah, but now we're out of it, I think is really surprising. I think the legislature will push back hard, but I think it's just on top of safety net support in an already expensive place to live, for particularly for folks with low incomes, like, like not doing more on housing, not doing more on healthcare, not doing more on food is essentially saying the state's just going to turn a blind eye. And so hopefully that's not where we end up at the end of this cycle.
Yeah. I think a lot about housing as a poverty measure because the cost of living,
Yeah.
obviously, in California is so high. We know that it's a crisis. I'm based in Los Angeles. We have passed a number of local measures around homelessness and housing, and I agree that this is the worst time to take our foot off the gas pedal just when we are making a modicum of progress. And I agree that the governor, we fought him very hard on things like care court. He was so interested and invested in services to the unhoused, and that program has not um, been, I don't think, anything like the governor expected it to be, and in the end, quite expensive.
Mhm.
But these things take time to unfold, right? To your point that if we cut the funding now, there's no chance for success
Yeah.
or growth or progress in this area.
Mhm.
One of the other things that I was thinking about is, I mean, just to pull back for a second, we talk about like what are our California values in the budget. If the budget is a value document, like what are California's values? For me, it's really hard to say that California has a fixed set of values because I think there's so much diversity in the state of position of political leaning. Obviously, we have demographic and geographic diversity that has a lot of different outcomes. But what what would you say are the sort of leading Californian values that we should look to our to hold our government, the governor and the
Mhm.
legislator, as well as our local governments, accountable to?
Yeah, I think, I mean, there has been some consistency to this for a long period of time, but within that, some variation. I think we're in a period where there are questions about some of those earlier values commitments. I think for instance, uh, we've been a state that has said we would specifically work to build out food assistance, childcare, healthcare, housing for communities that couldn't access it or were excluded by the federal government. That's something we've been doing for well more than a decade. We've often been a state, even before that, that said, oh, we're going to take all the flexibility we can get from the federal government to make sure as many people can access benefits as possible. So we get all these, as you were talking about earlier, with the complexity, like we have all these waivers in the system that we've applied for from the federal government that have allowed us to expand in ways that a lot of states haven't, and we've been innovators in that regard. And so I think those commitments, like those values, have had commitments associated with them that have been pretty consistent. But I think what's in kind of changing or in question right now is 5 and 6 and 7 years ago, looking at the affordability challenges that low-income Californians were facing, state leaders really came together and said, like, we think healthcare is a right and we think everyone should have healthcare. And there was this gradual budget year by budget year build out to make sure that there was health for all, right, as the campaign was known.
Mhm.
Um, and there were commitments made to build from 120,000 slots in the childcare system to 200,000, which is way less than we need. We need like 1.8 million more, but like to try to build that, almost double the size of that program and make sure more people could access childcare. And those kind of commitments were like value statements about that people who struggle to make ends meet deserve a better shot in our state. Otherwise, they won't be able to stay here, and that's bad for our state's economy too. And I think what's troubling about what we're seeing right now in the state budget process and with the cuts from the federal level is more more than we thought sort of responses in the like, okay, then we need to pull back on our own state systems. And so that whether those values are like as whether current state leaders are feeling as beholden to those values is, I think, a question mark that's a bit troubling.
Yeah, we are seeing um, that as people shift through term limits or they're terming out of the legislature, especially, and we're at the cusp of electing a new governor, that um, the solidity of our values is, like you said, an active question. And we've found that we really need to do a lot more educating of our legislative partners about
Mhm.
the long-standing efforts that we've made, the progress that we've made to combat poverty, and what is and how to make priorities now with what we have. I don't know if you're
Yeah.
experiencing the same thing.
No, absolutely. I mean, there are so many things that are wonderful about all of the new folks that are in the legislature, and I think we're like well over 60% are in like their first or second, term. It's a pretty young, I should say, in terms of experience in the legislature. It's a pretty young group, and there's a lot of exciting representation from across the state in that regard. But yes, the like depth of experience in the delivery of these key services and these vital programs, and then understanding the policy commitments that were made, and then where you can then continue to build off that foundation is, I think, a place where we have a lot, as you said, education to do. And I think we've probably been a little surprised that how much of that needs to be done. There's a lot of like staff foundational work that you think that I would have thought would have supported that, but I think we've underestimated how much staffing changes there have been too. And it's in some ways, it's like we need to go back 10 years and say, look, coming out of the Great Recession, these are the choices we made. And then we tried to build these things back and make these expansions. And the trajectory was all good, right? We were doing well. And you need to stay the course on that and be the next person who holds up to those commitments.
Yeah, I think about doing educational piece and connecting it to the larger march of towards progress on a lot of these issues. And I'm thinking about our responsibility also to do a kind of public education and narrative piece. And I think it's
Mhm.
really hard. And we'll talk about taxes next or revenue side solutions. But I think it's really
Mhm.
hard. And to talk about California without thinking about, oh, we're a state of innovation and progress and huge industries that bring in billions of dollars and make us this incredible economic force in the world, not just our country. And at the same time, grapple with the incredible wealth and income disparities. And something we think a lot about at Western Center. How can we talk about issues that right size the
Mhm.
reality and the historic imbalances and the structural choices that we've made through policy to disinvest from communities to um, over invest in business. I think that your group
Mhm.
had a line in one of your budget documents that talk about tax credits and business credits. Like that's a
Mhm.
trade-off, just like HR1 is a trade-off of um, a tax cut for the ultra wealthy and for corporations at $1 trillion. And where did we get that money? We took it from, um, you know, federal benefits programs. Um,
Yeah.
yeah. How are you
Yeah.
thinking
I mean,
about education and narrative change? But yeah, go
yeah, I mean,
ahead.
there's so much, and I think one of the Q&A questions is trying to tee this up a bit. There's a lot of narrative change that has to be done because we've had a also going back to the values question. California voters in particular have consistently said when it comes to our state income tax that they think that should be progressive. Well, and better, higher paid individuals should pay more, and so we have one of the more progressive income tax systems in the country, and that's the main source of state revenue, other than federal dollars and things like that. So, we have this narrative of it's already progressive enough, right? It's already and except like you have to think about how much has changed in the last 8 or 9 years. So, the Trump tax cuts in 2017, which were put in place to actually cut federal programs in a huge way, reduced the corporate tax rate at the federal level from 35% to 21%, an unbelievable deal for particularly the most profitable corporations, right? So that was like one big step. They received more breaks in HR1, this latest edition. And then the primary reason all these HR1 cuts are happening is to offset the costs of giving personal income tax cuts to the highest earning individuals in the country. They're very skewed to where it's like the top 20% are getting like 95% of the tax benefits. Um, so you add all of that up and and then you take into account that like the way the policies are being structured was to actually purposefully go after states like California in a very political way. And it's hard not to look at all that. I would argue our state leaders should be looking at all of that and saying, like, look, all of these folks, most profitable corporations, highest income households are getting a really great deal from the federal government. And it's being paid for on the backs of the people who are already struggling to make ends meet here. And so we have a responsibility and an obligation to respond in the tax system. Like the federal government didn't do this just by looking at the budget and making cuts. They did it by looking at the tax system, and state leaders have the exact same responsibility. They're not yet, but like that's our job, right? Like that's your organizations and my organizations and all of our friends have to like hold them accountable to take some of the same tax policy actions in a counter action sort of way.
Yeah, I agree. I mean, we think about these massive programs that are designed to mitigate poverty. And we saw, of course, during the pandemic that we made huge gains in reducing poverty, especially for children, by having more robust programs to support people who need help making ends meet. Um, and now I just lost my train of thought. But we've made this progress. We know it's possible, but we can only stretch what we have so far by cutting. By cutting benefits, we can, putting back the Medi-Cal asset test, reducing immigrant access to food benefits and healthcare. Sure, we can cut, but eventually we need to get to the question of, well, how are we funding, and can we put our values towards properly funding the government to help people who need it most and not to help only businesses and corporations. So, can you do a quick survey for us what the different revenue side, or if there's a better phrase
Yeah.
to use, options that are out there?
Yeah. I mean, it's not a super long list, and it will take multiple years of efforts to be clear. But I think the near term, most sensible, low-hanging fruit option for state leaders, because they can do it legislatively, they don't have to go to the ballot because there's not something in the Constitution that needs to go before voters, is to go address the corporate tax side of the equation. And one of the things that you signaled earlier is the state gives away billions of dollars in tax breaks to corporations. The narrative, unfortunately, that's out there, the business community does a great job of pushing it, of course, is that we have one of the highest corporate tax rates in the country, which we do at 8.84%. Um, but when you add up the billions of dollars in tax breaks that we give to corporations, it cuts that effective rate in half, which puts us about middle of the pack. And that story doesn't get told. And then you take into account that we have among the most profitable corporations in the world, that are located here, and that they've seen their earnings and their profits double and triple since the early 2000s. Huge increases just since COVID-19, for instance. Uh, and then they've received these tax breaks at the federal level, and you have to sort of say, look, is this system adding up in a fair sort of way? And state leaders could start by just reducing some of those tax breaks. So there's a tax break in the state tax code right now that essentially gives a break to corporations that are able to offshore their profits, to basically claim that their earnings are sitting in a place outside the border of the United States, which is a way to just shelter profits and make them non-taxable in California and for the US government. The state could take that tax break away. There's no economic reason for it. It's just a deal that they made with corporations years and years ago, and it could go away.
Yeah. Um, I think about, 'cause to me, this is also a narrative question too. It's called, I don't know, a stimulus if we give corporations tax benefits and tax cuts, but it's a handout if we give it to people who are living in poverty. And I think that's a real question that we need to do, as you said, collectively around the narrative change about who who these tax benefits or tax cuts or raised taxes actually impact. There was something in the LA Times last week about how only 52% of people support this billionaire's tax for healthcare that's going to be on the budget, I mean on the ballot. And while that's a majority, they thought that it would be much further ahead because people's interests are in, there are so many of us who are not billionaires. I think there are 200 billionaires in California. And we are not realizing our people power to shape those changes. Which leads me to the question, of course, the ongoing question of how we frame this. But I interrupted you as you were going through the different tax. So the first tax measure could be a legislative fix to end some of the corporate taxing
Yeah, yeah, and then
tax breaks.
there's also something you could do. You could make the corporate tax progressive, um, which would be like our income tax, right? So we could basically say if you're the most profitable corporation, you need to be paying more than say that, the local small business, that local coffee shop or that local restaurant. Like, why are they paying the exact same tax rate? Many of them are in fact paying more because they can't access these corporate tax breaks, which are primarily for the big corporations. So that 8.84% rate we've put on, they're paying like that rate, and the big corporations are minimizing their tax bill. So, that's another thing we could do in the near term.
Yeah. Um, we uh we are really thinking about this tax on wealth. Um, and I think about the tax on wealth, which is obviously different than an income tax. Um, in a reparative sort of way, if we think about the structural ways in which we have disallowed many communities from accumulating wealth, and I was reading a book about the history of taxation and talking about how way before there was an income tax, there were property taxes and properly wealth taxes. So this is not a new idea at all, but can you go through and kind of describe what this proposed tax to help fund healthcare looks like?
Yeah. I mean, I think it's first important to understand that in the only way that we tax wealth now is by taxing property, right? So we do tax the wealth that people create through the increasing values of their property over time. But we otherwise don't tax wealth, and wealth and income are very different. When we say income, we mean wage and earnings, right? The salary or the hourly rate that people receive. When we say wealth, we mean like all of the value of the stocks, property, other holdings of value that people have that they're not necessarily selling on a day-to-day basis. These are just things they own that add to their overall net value. And the scale is just off the charts different, right? You take one of the wealthiest people in the state of California is Mark Zuckerberg. His estimated net worth is $250 billion, which is essentially the size of the state budget, right? Um, you know, like compare that to a CEO of a company that has an annual salary of $250 million, right? The scale is astronomically different, and yet that other person is still making 250 million, and we actually tax that $250 million person at a pretty high rate, but because we have a progressive income tax. And so the fact that we're not taxing wealth means we're not getting to like a huge part of the economy. Um, the other issue here is that folks will go like, well, they're not selling it, they're not transacting it, so like, how can you tax it? And it's like, well, they actually are. They borrow against that value, they trade against that value all the time, so that they don't have the kinds of transactions that we pick up in the tax system. So what you're seeing now is people are trying to think about ways to get at that. So this measure that's on the ballot this year, or could be, it has to collect enough signatures, would put a one-time 5% tax on the net worth of folks like Mark Zuckerberg, who I mentioned. And it's essentially like for 5 years, so it's 1% for a year, and the funding would all go to healthcare, food assistance, and other sorts of programs that were cut at the federal level. Um, it's not it's struggling so far, both to collect signatures and with public opinion, and a lot of that has to do with I think it came out as a surprise, and not everyone on who might be an ally for it was ready for it, and there were other things they were thinking about. So there was sort of a coordination among the potential friends issue. And then the narrative that the billionaires are putting out there has been really toxic in terms of like telling stories about how they're going to leave the state as a result. And then a lot of things like covering where they've purchased properties, which doesn't have anything to do with where they reside, by the way. They all own properties in tons of different places, but it gets sold as, oh, they're moving to Florida or they're moving to Texas. And so that's been a really harmful narrative for even trying to have this conversation in a responsible way.
Yeah. You raise a good point about how difficult it can be to work in coalition and making sure everyone is sort of aligned before you launch a thing. Nothing's ever, I think, perfectly aligned. But before we get into how we can work
Yeah.
better together, I know that the California Budget and Policy Center has really been focused on revenue and these types of solutions. How did you come to that decision, and what does it look like to make that policy solution a priority?
Yeah, yeah. So for us, what that means is we did we were in the middle of going through our own strategic assessment of where we were organizationally, and basically with everything that's happening federal and state, we're asking the question of why aren't we getting bigger gains than we should be seeing on behalf of the people we're trying to serve? And you can't answer that question without coming back to there has to be more money in the system. We have to grow the pie. There's not enough to even do to
Mhm.
meet, there's not enough at the state level to meet current needs at the state level. And then there's certainly not enough when you add federal cuts. The only way to answer the question and get to some kinds of solutions that help Californians is to have a revenue conversation. That seems abundantly clear. What it means for us is that we have to help build the coalition rather than sort of stand on the sideline and be the like nerdy research partner. So like well, Cori, because you all have led these coalitions in other spaces. If you want to have a food assistance coalition or a Medi-Cal coalition or a housing coalition, there are robust networks of advocates across the state working together all the time. And it's not always aligned, but it gets aligned, things get done, they get wins. Nothing like that exists on the revenue space. We just do it episodically when like ideas come up, like this billionaire's tax idea, or in prior years, just ballot measures stuff. And that's not going to get the kind of pie growing we need going forward. So we feel like we have to step in and help lead that.
Yeah, well, thank you for your leadership. And I think there are a lot of things that need our coordinated effort to
Yeah.
reflect not only the California values, but also the vast majority of Californians who are not billionaires, who are not ultra wealthy, who are struggling to make ends meet, who have really unaffordable cost of living, especially through housing. And there's so many incredible organizations like yours, and community-led movements that if we could figure out the way to and I think many groups are working on this, like We Are California, on coordinating our efforts, doing the narrative change, talking not only about protecting programs, but also creating the future we want to see. I think we could be unstoppable. Um, on that note, I want to open it up to see if there are any questions from the audience. There was a question about the strategy to reframe taxes on millionaires so they can see the value. Um, and I think there's also the sort of persistent narrative about bloated government and liberals, I'll spend side liberals, and we have a lot of work to do around.
Yeah, it's exactly the right question, I think, because if you some of that the polling you mentioned earlier, some of that same polling shows that when you ask Californians if they think wealthy people or corporations should be taxed more, you get high percentages that will say yes, but if but you also get a fairly large percentage or what diminishes that is that people think, yeah, but government might not actually spend the money well. And if that challenge sits there, it's really hard to get over the hump in terms of convincing people to support some of these measures, particularly when really well-resourced, well-funded opposition emerges that has effective narratives on their own. And I think, unfortunately, we folks like that are doing the work like we've all done, we're good at telling the story to like policymakers. We're good at the technical. We're good at the wonky. But like we need the general public to understand the successes that government has had. I mean, the fact that California adopted Obamacare, built out a system very, very rapidly, which didn't have as many hitches as one might have thought for a state of our size, and then was providing healthcare to so many people in our state. That's a story we needed to figure out how it's told about what an amazing and a success that was. the expansion of stimulus assistance, like you mentioned, with combination of federal and state, we cut the child poverty rate in half in California in a year, right? In a year. There
Yeah.
are real successes that need to be told about what government can do in these instances. But we're trying to deal with this skepticism that there'll be waste, fraud, and abuse in the system. That, like, yes, of course, it's a huge state. There'll always be some small errors. Some people will take advantage, but it'll be really tiny percentages, and the vast majority of the time, the system is working pretty well, the rest of it.
Yeah, I know. We need some pithy phrases like waste, fraud, and abuse to use on our side because once you start debating, you're getting into the wonky technicalities, like you said, we're losing people before they,
Mhm.
but waste, fraud, and abuse just rolls off the tongue and it sounds like a fact,
Yeah.
even though it is not at all what it's made out to be. And I'm going to ask you another question that was in the chat because I think you might be in a better position than I am. I mean, are other states doing anything to have more progressive or equitable tax solutions? Uh, are there any that are working on it? And do they have lessons that they can teach us about narrative and framing and messaging?
Yeah, I think hopefully, yes. I mean, the one thing I would say that in some ways is contributing to our disappointment about what we're seeing from our state leaders so far, but we hopefully actually lights a fire underneath them a bit, is in other states with political dynamics similar to California, you are seeing responses to pull back through the tax system some of those revenues the federal government gave up. So there's an effort to put a tax on the highest earning individuals in the state of Washington. It's pretty notable in the state of Washington because it's never had an income tax. So to put an income tax in place for the first time and just do it for the highest income folks is a significant potential move. There's a series of tax measures that are all progressive in orientation that the state of New York legislature is putting on the table as a way to make sure they have revenues to undo some of the cuts from HR 1. So we are seeing some of this in a couple of other states. We have our own experiences here because we have created a progressive income tax system. That doesn't mean we know exactly what these narratives are, but I think it does fundamentally come down to a fairness. Um, like maybe we need to sort of say, like, why you can't have nice things in California, and it's because they're concentrated in the hands of a few folks.
Yeah.
And unfortunately, it's a little bit of an us versus them kind of an argument, but we're seeing a lot of polling that suggests the public's pretty amenable to that. And then we just need to solve the, like, well, how are they going to spend the money and are they going to do it responsibly kind of question. So,
Yeah. This fascinating study that talked about effective messaging. And I hate to say it, but one of the most effective messages that you can say is that the system is rigged. And
yeah,
we've heard that in really bad, the political system is rigged. We've heard that from people who might not have the best intentions with that. But
yeah,
in a way, our system is very rigged to benefit and to continue to benefit the most wealthy.
yeah,
Um, and so I hate an us versus them narrative. But it is, if we think about the policy and structural choices we've made, it is made by people with wealth and power. Those people often make campaign contributions and policies made to benefit those people in wealth and power.
yeah.
Um, oh yeah, I will share that messaging study. I will. We might need to send it out in the follow-up because it will take me a minute to dig through my emails. But it was an incredible study, and that people often don't identify themselves as necessarily living in poverty. People think about, oh, well, I'm broke, but this is a temporary situation, and given the right opportunities, we can, I will have better circumstances. And so I think sometimes people think, oh, well, I don't want to be taxed, so I don't want to raise taxes generally because they think it's going to impact them.
Right, right.
Um, okay, so I will share that study in the follow-up notes. I'll have Nora send it out. Okay. I think the next question we have is, how can we tug on people's heartstrings and emotions when we talk about revenue and taxes? And I think that's an excellent question because, as we know, economics is so emotional, right? Like people use their money or don't in very emotional ways. Do you have any thoughts on this?
Yeah, I mean, I think some of the messaging studies, probably like the one that you mentioned, have some good lessons for us. I think in some ways, we have to get better about using examples and telling stories that are about one individual's experience versus another individual's experience. Like it's
Mhm.
great that the California Budget and Policy Center and Western Center on Law and Poverty can tell you how many people will be impacted by a policy change and what the aggregate dollar amount will cost. But people don't often have a good sense of how many people is 3 million people relative to the size of the program. How much is 250 billion versus 25 billion? Like, it's those things don't translate into like hearts and minds
Yeah.
kinds of arguments easily. And I think it's telling the story more about an individual who's working two jobs and trying to make ends meet and make sure there's food on the table for their kids and what their experience is like on a day-to-day basis, relative to someone whose net worth is $200 billion dollars and who is so entitled that, they their response to the state, even considering having a wealth tax conversation, is, I'll just buy another expensive home in Florida. Um, and I think if those two experiences are juxtaposed, the oh, go ahead and buy your home in Florida thing just doesn't become that big of a deal. But we're only letting one side, we're only telling the story, right? The billionaires are telling their story, the wealthy folks the most profitable corporations are telling their story. And we need to counter with some stories about the folks on our side. And yes, we'll always have the numbers, right? But we need to like go narrative for narrative with them.
Yeah. I think that goes hand in hand with this idea that people who receive government benefits are not working, right? That's why we need a work requirement because
Right.
people not working and they have handouts. And you think about people,
Yeah.
especially in cities like Los Angeles, where there's so many people who are working in the gig economy and, like you said, are
Right.
putting together multiple jobs, working extremely long hours. And from the healthcare lens, because of a
Yeah.
concerted campaign from companies like Uber, they aren't able to access healthcare benefits in the same way
Right.
as somebody who was regularly employed.
Yeah.
We have a question in the chat about like this narrative is really does have a racial component. And the stereotypes of people who are living in poverty or receive government benefits are deeply racist. I mean,
Yeah.
this goes back, I feel like before the
Mhm.
inception of some of our most common public welfare programs. This
Yeah.
concept of who is working, who adds value to the economy is not just racist, it's very anti-Black, and
Mhm.
anti-immigrant, anti-Native American. Do you have any other thoughts you want to share on that? Like, how do we
Yeah.
uplift that piece of it as well?
Well, I think the comment in the chat is right. Absolutely, there's a huge racial component to this, um, and I think we need to be cognizant that, like, particularly when you connect it then to tax policy, that this country is once again, which it has done multiple times every few decades, having a conversation about what it means to be we the people, right? Who gets included in that? And it's why I'm just, as I said earlier, and neither one of us would like to have an us versus them conversation, but the them in this case that are fighting the kinds of things we want to see happen are making a very explicit choice, doing it boldly and influencing policy in huge and harmful ways to make sure that the folks that we think of as us are left out. And I just think like the fight has to be on behalf of those folks and to sort of say, look, you've broken the social contract. Whatever was left of it, you've broken it. And so therefore we're not coming after you with pitchforks, but we are going to come after your revenue and your wealth. So
Yeah. I can't think of a better note to end on than to say, like, who we are having this conversation about we the people. And it's incumbent on organizations like ours and the partners we work with to make sure we are defining who's included in we the people, and
yeah.
that the interests of the us of the many um, are not drowned out by the very wealthy few. Is there anything you want to add before
Just,
we?
I just want to say, can't think of an organization that's done a better job of trying to be inclusive about that we the people question than your organization. It's the work you all did on things like the maximum family grant, asset tests, work requirements that were the reasons we got the wins we got. We're now trying to protect them, and we're in this moment of having to have that fight again. But we do know what it's like to fight those fights because of the good work that your organization, our organization have done.
Yeah, we couldn't do it without your partnership. And thank you so much to everyone for joining today. And especially thanks to you, Chris, and the California Budget and Policy Center for all you do to equip us with so much information and so many brilliant ideas that can transform our state. And with that, I will hand it back to Nora.
Thank you. Thank you both so much to our speakers, Cori and Chris. The depth of knowledge and commitment you both bring to this work is so evident, and we're so grateful for your time. Like Chris and Cori said, this is going to have to be a coordinated and collaborative effort. And so we're so thankful to everyone who joined and engaged with us this afternoon, whether you're an advocate, organizer, policy professional, or someone who just cares about what's happening in California right now. Your presence in this conversation really matters. Um, we'll be sending a follow-up email to everyone who registered and attended in the coming days, which will include a link to today's recording, all of the resources or reports that we referenced during this conversation, and of course, more information on how to stay engaged with Western Center on Law and Poverty and the California Budget and Policy Center. If you're already not connected with our organizations, we encourage you to follow us and sign up for updates. And as you know, the budget process is ongoing, and there will be a lot more opportunities to engage in the weeks and months ahead. Thank you both, and thank you everyone. And I hope everyone enjoys the rest of their Monday, and we hope to see you at our future webinars.